It's incredibly important for students, I think, to be aware of their own mental health and to have a kind of a sense of what emotional well-being is. It's such a stressful time. There seems to be more stress on students than there ever has been because there's all the kind of financial worries that we didn't really have when we went to university. You're leaving home, you're starting to discover how complex it is just to kind of look after yourself. You've got to make new friendships. There's a lot of pressure to be popular, to belong, and then there's all the studying on top of all that.
Working at Sheffield Mind is, it can be very rewarding, but it can be very challenging as well. We do have to deal with some quite complex and sometimes quite upsetting issues.
We've got a really fantastic staff team and a great group of volunteers. There's a real sense of us all working for something that we're really passionate about.
It's got quite a good reputation in Sheffield, so it's a place that people know about and are reassured by, and if they are having problems, they know that if they come to us, they will actually get the help that they need.
So this conference today, which we've put on with Braithwaite, the Braithwaite Trust, who work with young people, really is another way of illustrating how important it is to think about young people's mental health.
Sheffield Mind is part of a wider federation of 140 local minds, National Mind, which is the national body for mental health across the whole of England and Wales. The mental health of young people generally is not improving. In fact, there was a big survey published just last week that said that particularly amongst young women, the levels of mental health problems are on the rise between the ages of 18 and 25 in particular. And of course, that absolutely includes the student body. At Mind, we've launched a new app called Limongi, which is all about how you can talk about your feelings through a phone, through using emojis. We also work very closely, increasingly, with student bodies and student and universities to raise awareness of the issue of mental health, because you're absolutely right. Really, one of the issues is that we just don't necessarily know what's happening to us sometimes until we're in the middle of a mental health crisis. So we've got a role to play in educating people to spot the signs and the symptoms, and for people around us to be able to watch out for people who we care about.
I got invited to the conference. I'm a fellow of the charity Braithwaite and I do a lot of work with them, and I'm real passionate about mental health. I'm currently on a walk from Halifax to London, so I thought it'd be a really good opportunity to come, and they asked me to come and do my talk, and I've done that, and it's been received really well, so it's been an amazing day. We're actually going to meet the Health Minister just under Jeremy Hunt in Parliament. We're having a meeting with her. We're under a letter of some demands, I guess, that we want to bring to the attention of the government. You know, you're more likely to die by suicide than you are by a car crash or by cancer if you're a man and you're under the age of 45. One man every 2 hours takes his life in our country, and we just believe that it was just something needed to change. So we decided to walk from Halifax to London. Bit of a crazy idea by myself, but we want to raise the awareness around for men and raise some money to open other clubs, because Andy's Man Club at the bottom of everything that we've done so far campaigning wise is a talking group for men, and we want to make these accessible for men all over our country. I'm currently barefoot because my feet are very blistered, so because I'm at this event I've already done 4 miles this morning. I've got another 12 to 16 to go today. Got to get back in the van now and get down there, so yeah, my feet are a little bit battered at the minute. So. Came up this time because this sign symbolises that it's okay, and on the back of our t-shirts, you can see it, it says it's okay to talk. Because it's not just about male suicide, it's about mental health as a whole. 1 in 4 people has got mental health problems, so if you put that in perspective, if there is 80 million people living in this country, that means there's 20 million people are going to either have or have had a mental health problem in our country.